We do not get older. We just become more. We become more of who we are. And that is a beautiful process. And I think that is the most important thing that I can sort of pass on is you actually don't need to do anything. You just need to be who you were meant to be. Right. And if you can just tap into that and just really focus on the things that really bring you joy and happiness and kind of take you to that magical place, everything will sort of show up for you.
Welcome to the Midlife Reinvention Podcast. I'm your host, Kavita, and the founder of Power Purpose Play, a global community of women in midlife. I'm here to tell you that it's your time now to rediscover what has always been inside of you and bring that out into the world. If you're wondering what's next, but don't know quite what that is, or if you feel a twinge in your heart telling you that you have so much more to do and so much more to offer, you're in the right place. Ask yourself, if not now, when? Do you want to leave your job, start your own business, take control of your health, reignite the passion in your marriage, write that book, or at least that first chapter? Transitions like this can be daunting, but through listening to my story and interviews with incredible women every week, I hope to inspire you to take action. I rediscovered myself after the age of 50, and I know you can too. It's my time now to help you do just that. I'm so excited you're here. Let's dive in. So to that end, I'm really, really pleased to be introducing to you today our amazing guest and Dr. Rupinder Toor. And Rupinder is a founder and a medical director of the IUD Women's Clinic in Calgary, Alberta, Canada. And she has been a champion and innovator of women's health and culturally appropriate healthcare. And Dr. Toor has been a pioneer in establishing women's health as an area of focus within the scope of family medicine. And she shares her passion for these areas with students, healthcare professionals, and her community. So I'm just super pleased to have you here, Rupinder, and thank you so much for your time.
Thank you for having me, Kavita. I'm super excited to be part of this, and anything to do with empowering women, I think is really, really good work. So thank you for organizing it.
Well, you know a lot about that, so I'd love to hear more about that. And your expertise is so relevant, especially for our audience. And approaching midlife, we all have facing different healthcare issues, which are unique to only us. But before I get into how we can tackle those issues, I just wanted to find out a little bit about yourself and tell me a bit about your journey and where you got started and how you came to do what you're doing now.
Wow, that's a really long... Where do you want me to start?
Okay. Wherever you'd like to start. Whatever you're comfortable with starting.
And then I'll give you a little bit of story about my journey. So I am a medical doctor. I have been in practice for over 22 years now. And every time I say that, I kind of shock myself because it feels like it was just yesterday. And about 13 years ago, I really started to focus on the women's health portion of my practice and kind of develop that, and have learned a lot from my patients. And sort of how I sort of shape my ideas about the world has really been shaped by the women that I meet. So that's been a really fun and interesting process. I can share you a couple of highlights as to how I sort of came to where I am. So I'm going to share one story with you, which I think it's valuable in sort of knowing where our life course is going to take us. So back in 2012, I had the opportunity to go back to India. That's where I was born. Yeah. And I actually got to visit the hospital where it was like a rural hospital where I was born. And my aunt, who was a maternity nurse, who was actually at my delivery, happened to be with me on that trip. And I kind of wanted to go see my birthplace. So she took me through and she took me into this one room and she says, hey, she goes, come look in this room. Mm-hmm. And it was just very basic, kind of like a surgical suite. It had some windows that were looking out into a field, very kind of like rural, kind of some animals kind of grazing and stuff. And she goes, this is the room that you were born in. And I thought, wow.
Oh my God, that just gave me the chills.
It was kind of like humbling to think. And so as I stepped out of the room, I noticed this poster on the wall and it said, save the girl child. And I thought, my goodness, like here I was, a girl child born in this rural hospital in India. Nobody could have imagined my life trajectory, like where I was going to end up, that I would come to Canada, become educated as a medical doctor, come back and actually be able to sort of kind of visualize those things tangibly. And so I think that was a really good lesson for me to think that anything is really possible. So I think, we really do sometimes limit ourselves, but that's the only thing that's really limiting us. Because if someone had said, well, this girl born in this hospital is going to go do these things, like people would be like, oh, as if this would ever happen. Right. But it happened. Right. So that was a great part of my journey. I felt like that was a great kind of point to think about. It was almost humbling to know.
And when was that? What stage of your career was that in?
That was 2012. So I was medical trained. I was kind of had started the women's health kind of journey and stuff, but kind of came a little bit on the cusp of as those things were sort of happening. The other thing, so I can think about, is that when I was in medical school, this is where that seed for the women's health portion really kind of got planted. So we were learning about cervical cancer. And as a good daughter, I went home and talked to my mom. I said, Mom, have you had a pap smear done? And she says, oh, yeah, sure. I've had it done. And I said, well, when? And she goes, well, it was when your brother was born. My brother was close to 20 at the time. So she had not been going. It was supposed to be annual at that time. She had not been going. And I said, well, why aren't you getting this test done? She says, well, I have a male doctor. I don't feel comfortable seeing him for this type of thing. And I said, well, are you not worried you're going to get this cervical cancer? And she says, well, it's kismet, it's fate. If it happens, it happens. And so in her story, just a few of these barriers that were stopping her from going for something as simple as a pap test. And I started talking to my aunts and my cousins, and same story, same reasons. Nobody's going for all of the same sort of issues. And so this is where that seed was planted, because I thought, well, here I am. I'm a South Asian. I'm a woman. I'm South Asian. I can speak Punjabi. I'm a medical doctor. Like, if anybody could solve this issue, it would be me, right? And if not me, then who, right? So when you look at sort of, when I was looking at where am I uniquely, like all of my sort of life circumstances and everything, where have they placed me? Like, there's an opportunity for me to give back in a very unique way that maybe somebody else wouldn't be able to do or wouldn't be on that forefront to do. And so that's where the seed for the women's clinic got planted. It was when I was in medical school, and I thought, what if I opened up a clinic where we had just all female doctors, maybe spoke a few different languages? Then would the women feel comfortable coming? And the answer 13 some years later is yes, the women will come. And we have served over 50,000 women. We are employing almost like 14 doctors now. And so I think there's nothing more powerful than an idea whose time has come, right? But you just need to be kind of listening for those ideas, because they will come to you, right? They will come to you in that moment where you're like, this is interesting, right?
Well,
so anyways, that was one of those are two, I think, important parts of my life story that I wanted to share.
That's just amazing. Really great examples. And I think what I got from those two examples is that you listen, though. You listened to what was around you and you acted upon it, because I think you got the signals from India and from your mom and from listening to your relatives, and you did something about it.
Well, the third part I didn't mention is that idea came to me when I was in medical school. So I was probably in my early 20s at that time, right?
Yeah.
And I didn't actually implement the clinic until many, many years later, because I also understood as a woman that I would have to balance, or there'll be different priorities for me at the different stages of my life, right? And so after I completed medical school, I was working a lot. I was just trying to pay off some student debt. And then I had my kids, and then that was kind of my priority at that time. I thought the time from 0 to 5 was really important to me. And I understood that, I kind of put my career a little bit on the back burner at that time. I was just working minimum hours just to kind of get by. Yeah. But when they got into school full time, my daughter, who's the youngest, once she got into kindergarten, I was like, okay, now I can focus back on my career. And that's when I revisited that idea that I had in medical school. So it's also about pacing, right? That you don't have to feel this pressure. Like, listening is really important, but also listening to when is going to be the right time as well, to not put these expectations that we need to do all of those things like right away. Because sometimes there is, like, I think life really only has, you can maybe fit 2 or 3 really important things in, and you have to decide what those are at the stage of life that you're in.
To prioritize, for sure. One of the things that you mentioned is that you had the idea, you listened to what was around you and the signals kind of coming from the universe, I would say. But then you also took action and you were like, oh, maybe can I do this or not? Right. So that's my next question, is that often women, they're held back, right, from doing what they really truly are meant to do, or that they have the true talents in. And often they're held back because they believe they're not good enough or they're not confident enough. What would you say to those women, like, to encourage them to really let go of those limiting thoughts that stop them in their tracks? Because this is what a lot of us do, especially as maybe in our midlife, we're we've done what we have to do, and maybe there's nothing new for us to do, and maybe I'm too old or I'm not good enough to move on and do something different. So what would you advise those women?
Okay, so I'm first going to take issue with the too old part.
Yeah.
Because I really do think we need to reframe how we look at aging, right?
Yeah.
And I think we need to not equate aging with decline. I feel like that's something maybe in the Western culture that we sort of think about. And I think that is a fallacy that we need to just give up because it's not serving us very well, right? So that's number one. Number two, my philosophy in this is that we do not get older. We just become more. We become more of who we are. And that is a beautiful process. And I think that is the most important thing that I can sort of pass on is you actually don't need to do anything. You don't need to do anything. You just need to be who you were meant to be. Right. And if you can just tap into that and just really focus on the things that really bring you joy and happiness and kind of take you to that magical place, everything will sort of show up for you, right? And so I think it's more about the art of allowing, where you can kind of allow these things to happen. Because I could tell you, for me, from my experience of when I had this idea to open up this clinic and whatever, when it happened, I could just feel that there was this momentum that was going, and I was just kind of tagging along for the ride. Like, I don't feel like I was really pushing anything. I felt like it was actually moving on its own. And like I said, I think like all of the right people showed up, the right circumstances, like whatever I needed, everything just started to line up. And that's where I knew that I had to follow this road, right? That to not follow it would be probably one of the biggest regrets I would have, right? But it would be, and it's not like I wasn't a businesswoman when I started out. I was trained medically. I had no formal business training. And I had to decide because of just the circumstances around the healthcare, Alberta healthcare at the time, like they just didn't have the budgets. Like they said, yes, we agree, there's a gap here, there's a need, but they just didn't have the budgets to kind of set up a whole clinic. So I kind of had to do it on my own. So without any training or whatever, I ended up kind of becoming this businesswoman now I started off as a non-for-profit clinic because that was really, it was more about the service to the community. That was really key for us. It really wasn't any of from the business perspective that I was doing it. But I think women don't worry too much about the details, right? Do not worry about the details. The details will sort themselves out. You just need to be open to listening, right? And like you said, I think there's these things that when something is calling you, it's calling for you. Why would you not answer? Why would you not answer that, right? Like there's something that's tapping at your door and it's saying, hey, look over here in this direction, right? And I just think, I really think it's a lot easier than we make it out to be, right? And you don't have to, there's not a lot of effort, I feel like it becomes, if you're on the right path, it should become effortless, right? You should feel like there is something bigger that's doing all of the work and you're just kind of moving along with it.
And I think you're so right in that when things fall into place and when you really listen to that inner voice or that intuition this is what you really have to do, then even if you do one small little action towards that little intuition or that little voice, it's amazing how things will just fall into place. And I really like when you said, don't worry about be who, like it doesn't matter. It's not what you do, it's who you are, who you're being. So is there a specific way or is there some tips you have for people to really tap into that inner voice, to tap into like, how do we really get to know what it is we're meant to do? Because it sounds like for somebody like, I don't know if you've always wanted to be a doctor or if that's something that was what you always wanted to do, or is that something that was kind of expected of you, or you know what I mean? Or is it something that, how do people really know, and how do they know, how can they tap into that?
Yeah. So I did not know that I wanted to be a doctor. I was not pushed into that at all. My parents, I think like a lot of typical immigrant parents, are really busy just working their jobs, trying to pay the bills. And so I always laugh and say we were always raised with this sort of benign neglect, almost like they were just busy. And so we weren't really supervised a whole lot and stuff, but there was no malice in any of that, but we weren't given a lot of guidance either. Right. And so I had no clue what I wanted to do. I thought I wanted to open up a daycare because I loved kids. I was like, oh, I think that would be a great thing to do. And it wasn't until I think Bio 30 in grade 12, we were learning about the human body. And I thought, wow, this is really fascinating. I think I could learn more about this. So then I started looking at careers that would focus on the human body. And so I was looking at paramedic, and of course, medical doctor came up, and all of these things came up. And I thought, okay, well, maybe I'll try the medical doctor route. That sounds like it would be kind of a fun thing to do. And again, not knowing personally really any doctors or having any kind of knowledge about how the healthcare system worked. I was just a young immigrant kid who had come.
Yeah.
And so I thought, okay, so I have to do an undergrad degree. Okay, so I like biology and I like chemistry. So I'll do biochemistry, not realizing it was a really tough degree to do. But so I kind of did what I needed to do. And then I figured, okay, I applied to med school. I'm like, okay, what I have to write the exams. And so I just did it in a stepwise process. And you're going to laugh at how naive I was, because when I got into medical school, I thought, okay, hard work is done. I'm into medical, my future is kind of like, I'm going to be a doctor. That question has been crossed out. And when I got to medical school, I had to realize that we now to decide what type of doctor we wanted to be. And I was like, I didn't even realize there was more than one type of doctor. I thought you were just a doctor, right? So if somebody
that's crazy.
Like me gets right. And I think the key in that was, it was just the small steps, right? And had I known when I was 18, this is what I was signing up for, maybe it would have felt too big for me. And I would have been like, oh, there's no way. Like, what are the stats on that? How many people actually get in from application? I think I would have you can start to get down to the cycle of not really self-doubt, but just confidence that you'll be able to do it. Whereas I think for me, almost the value of being naive was I didn't even realize how difficult it was. So I just did every step that I needed to do to get to the next step. And as I got there, I figured it out. So I think that's a good, maybe, that don't look at like what the big, like, I think it's important to focus on the why behind anything you want to do, because that's going to be really the key thing that's going to motivate you through that. Right. And for me, the why was just, like, I thought this was really interesting. And I thought this would be a neat place to learn more about. Right. And that was my only why. And so then I think that just kind of helped kind of guide me through and get me to where I needed to be. So I think just breaking it up into smaller kind of goals, I think, it sounds very stereotypical, but to not kind of get too overwhelmed by the big picture.
No, I don't think that's typical at all. I think that's great advice, because when you tend to focus on the grand picture, like, oh my God, I want to do this, and you go to the end goal, it's so daunting, and you can get very scared, and you can lose confidence in your abilities to actually get there. But if you do it in a small steps, like you said, and just trust the process, right? If you trust the process
and trust your motivation of why you're doing it.
Yes. So that's great advice. And focus on the why. I think that's really important too. And the how will take care of itself usually. Right? So
exactly.
That's wonderful. So, wow. It sounds like you really listened to your intuition, and you listened to what you were really interested in, like from the biology to the chemistry, and then, oh my God, right? So I guess if I kind of switch gears a little bit, in that you're dealing with women's issues, and what would you say right now? I know with COVID and everything, it's a little different, but what would be the main issues for women that are facing women in midlife that you see most often? And what is it that you find women are tackling or are really struggling with the most? Maybe from a healthcare perspective, maybe even from a emotional, physical, or mental perspective. What are some of the main things that women are dealing with?
I think some of it is also the cultural context, right? Because I see women from lots of different cultures, and I see that somehow their life experiences, even though as women, there's some things that really bind them together, and other things where they really do have a very different experience of life with. So I think a 50-year-old woman who's come from India will have a very different, perhaps, a struggle than a woman that's maybe grown up in Canada and has had a great career and has done lots of different things. But obviously, I think one of the key things for all women is sort of that the roles that we play, right? So we play the role of daughter and sister, and then we play the role of wife and then mother. And when we get to 50, some of those roles are kind of going into autopilots a little bit. They're not roles that we need to be so actively engaged in. So one of the interesting things I would say that I'm seeing, so obviously, the whole child rearing is going to get a lot easier as we get older, because the kids are becoming more independent and sort of developing their own lives. So you have this window of time. Now you have all this time that you were dedicating towards your children that necessarily don't need that anymore. And so I kind of laugh with my friends, and I say it's almost like I think I've heard the term recycled teenager, because you start to get all this time that you can, like as a teenager, where you can kind of do stuff, right? But the only difference is you have a little bit more money than you did when you were
and a little bit more experience and wisdom, right?
Yeah. So I
know what you want. to know what you want and what you don't want, right? Yeah.
I think it's an opportunity for women. We should be super excited about this time because this is time where you get to actually do a little bit of what you want to do after, like you said, you've had some life experiences to really reflect on what's even of value of importance to you. And I think it was my cousin's wife who'd said this to me once, and I thought it was brilliant. So she was kind of going through midlife at the same time. And she sort of said something like, I feel like the first half of your life is all your learnings, all your teachings, all the things you pick up, all the expectations of you, like what you're supposed to be doing, all of that kind of stuff. And then as you get older, it's the process of unlearning. It's like dropping the things that no longer serve you. And that is very exhilarating, right? And I always laugh. I say, I no longer have like a bucket list. I'm like, I have another list. It rhymes with bucket, but it's the stuff that I'm no longer willing to kind of do anymore, right? Because I just feel like, I can give that part up. And so again, it's becoming, you're now like, not only are you, I think emotionally, you've gone through your journey and stuff, like you're emotionally ready to kind of be who you need to be. But now time is also there for you to kind of do all those things. So I would think, and I think there's some stats to prove, I come across one when I was doing some menopause training, that over 50% of women felt like their 50s were like the best decade of their life, right? Because I think it's a time where you're getting some freedom back. Health-wise, you're still pretty mobile and doing everything you need to be doing. Money-wise, you've probably gotten to a point in your life where you're somewhat comfortable because you've had some years of kind of being able to work and stuff. Yeah. And so I think it's a super exciting time for women.
I absolutely agree. I really don't like that term midlife crisis. I think it's a midlife reinvention because like you said, we have the next half of our life in front of us, right? So why are we, and it's really our time now to really focus on ourselves more than we probably ever have. So, and you're right, the roles that we play, they're changing. The relationships we have are also changing. It's a matter of really tapping into what it feels good for us and what doesn't feel good for us too. We have to let those things go as well, right? So so important. I really like that. Rhymes with.
So to answer your question, I think this is my issue. I get off on tangents and I don't actually. So to answer your question, so I feel like, so the time, so that's always nice. And so people, you can look at that as an opportunity, hopefully, rather than a loss. Yeah. But the other really interesting thing that I see is that resurgence or that reacquainting yourself with your partner, right? For a lot of women who have been in long-term relationships, is they get to rediscover their husband again. And I think that's a lot of fun for them, right? And I think against what most people think, sexual activity actually increases when you get empty nests, right? And so it's another time to renew or regenerate that relationship as well. And a lot of women, when they get there, they realize they actually really like their husband. And I go, that's a fabulous thing to realize when you get to that age again, and you spend a lot of time just busy doing your roles and maybe not having that time to connect as often, to now be able to connect and reflect on all the things that you've done together and all the experiences you have. So I think that's a beautiful thing as well.
Yeah, that's absolutely true. You must see some cultural differences with that too, because the roles that we are meant to play in our life, like as an Indian person, for example, you're expected to be the mother and the wife and all that. But do you find that as we grow older or as we enter our 50s and beyond, has it changed in terms of culturally? Like, are women more kind of liberal and able to look at their own interests and feelings and relationships perhaps with their husband, or is there still that kind of cultural barrier that you see?
I think it depends where they've been schooled on their culture, right? Yeah. And in Eastern cultures, I think they're a lot more collective, and a lot of who you are fits into the roles that you play. And so oftentimes women in those situations will live in extended family. So now the son and the wife and their kids have moved in. So now the role of mother-in-law and grandmother really kind of start to play. So I think that depends. If you've been schooled in culture more on the Western kind of model, then we are allowed a lot of individualism. We're allowed to kind of discover things for ourselves outside of our roles that would give us fulfillment, right? And I think that's just a value set. And I think women just need to decide like what's important to you, regardless of how and when you've been schooled, what's important to you, and where do you want to focus your time and energy on.
That's great points. I would ask you maybe if you had a message for women as they're moving forward, and what would you say, what would to help them both from a health, physical perspective and maybe from an emotional perspective? What would be your main message so that women can live a healthy life moving forward? Is there,
I think
I know
women
that's
need
a broad
to,
question, but
yeah. Yeah, I think the best way I can answer that is I think women need to realize the value of the resource of women, right? I think we just take it for granted. It's sort of like me, maybe I wouldn't have thought about my culture and my language and all of these things as assets in my career, but they were the ones that really helped me to forge ahead. And so I think women need to realize that because we're biologically and socially kind of designed to look after everybody, right? There's a certain collection of experiences and reflections and things that we will have when we get to be mid-age. And that is a huge resource. And if you look at societies where they don't value their women, like they are losing out on one of the most fundamental and I think powerful resources in their society, right? So we need to reframe ourselves like that, because I think the kind of information and knowledge that we hold, we should share that, right? So I would encourage women to say, you know what, you don't have to have had any special life journey. Just your life journey as a woman is special enough. Right. And I would just encourage, I think maybe in the Western culture, what happens is sometimes we get a little bit more disconnected from our social or our kind of social constructs because we do value the individualism. But I think at some point, women as women, we should be sort of offering up some guidance, some wisdom, some mentorship to younger women. I think that is a really like right there. If you can't think of anything else to do, if there's a neighbor's daughter who's 15 and you think you can contribute, and it could just be these little conversations you have. It could just be wherever, just on your day-to-day kind of thing. And I think I'll share a funny story. My son, he wants to become a benevolent dictator, essentially. So he wants to go to politics or whatever. And I told him, I said, if you ever become prime minister, I go, you need to start. I understand this whole thing about the first lady and stuff. I go, but you need to create a role for first mother, because that the mother of the prime minister or the president, like, you know how how many resources she has and how many reflections, yes, and how she could contribute in a way, like, of course, in a Sarah, which is not actually going to do the policy work, but the framework of life and what she's observed and what she's come to conclusions, what's important in society to make a society thrive or a family thrive. Because it's not that different, right? What makes your family thrive is the same things that's going to make your society thrive, right? Or your neighborhood or your community or your nation, right? So if you think education for your kids is really important, well, then education for all children is really important. And that would be one of the biggest guiding principles in that policy of that government, right? So, but that's what I mean. I don't think we recognize women as a resource. And I think if we could tap into that as a society or as an individual, I think there's just no limits as to where that could take us.
Hi, my friend. Kavita here. Do you often feel blocked from moving forward? We all feel that way at times. These are referred to as energy blocks. I've created a short, actionable PDF guide to help you release your negative energy blocks. Click the link in the description to download it now for free. Now, let's get back to the episode. Wow, I can hear your passion in your voice about this. It's so amazing. Tell me about the projects you're working on, because I think it ties in with empowering girls. And tell me about that and what we can all do, like as you said, to empower women and to empower girls. I know that you have some great projects going on right now.
Yeah. So I think when we think about the doctor-patient relationship, we often think about, the doctor is the expert and the patient is just someone who's, showing up to get kind of help from the expert. But I've come to understand that it's actually the opposite, right? That my patient is an expert on what's going on in their lives, right? And I'm just in that sort of privileged experience here about it. And so when I kind of see my patients, I kind of do think about, okay, what can I learn from them that I didn't know before? And one of the biggest lessons I have been taught in life was from a 14-year-old girl. And so she was a foster child and she had already had a few sexual partners and she was using condoms sometimes. And I remember looking at her thinking, you're going to be pregnant in a year. And if you're 14 and you have a baby, like this whole cycle that you have gone through is going to just keep repeating itself. And how do we break that? Right?
Yes.
And I remember asking her about her birth control and she kind of said, yeah, it's working fine. And I thought, okay, I can't, like, I need to figure out a different way to ask her these questions, right? And I realized that my role was really to help her identify what her goals were, and then to say, okay, well, here's some medical science and technology that can help you reach your goals when it comes to your medical situation. And so I asked her, I said, when do you actually want to be pregnant? Like, when would that be for you?
Great question.
And she, first of all, she looked at me and she was confused because, number one, no one had ever asked her this question before. She had never contemplated that this is something she could actually choose, because what she taught me was that in her life experience, things happened to her. She did not get to choose what happened to her, right? And when you look at the most vulnerable in society and the most privileged, that is the biggest difference, right? Is how do you get to determine your life experience? And so when you don't get to choose what happens to you, you lead a very disempowered life experience, right? So you feel like things are just happening and you're just reacting and you're just trying to get by. So you don't ever get into that creative mode, which is where we all want to be, as far as what can I do in my life? What choices do I have? Where do I want to go? Which path do I want to go down? And so she looked confused at first. And I said, no, tell me, like, when. And she, of course, most teenagers, none of them, I have not yet to meet one teenager in my practice, regardless of what people tell me, who says, I want to be pregnant the next year. They're always like, no, like, not now. Of course, not now. Like in my 20s, like when I'm older.
Right.
And I say, okay, so I go, if that's what you want to do, I said, here are some tools that I can tell you that will help you reach your goal. And so one of the things that I do in reproductive healthcare is we talk a lot about what we call better birth control. So sometimes we think of birth control is all works the same, but there's actually huge variations in how effective they are. So we're really, as medical doctors, we've been pushing a lot of the long-acting forms of birth control that have effectivenesses over 99%. But what I found with these girls, Kavita, was it was amazing, because when we got to that conversation and I said, okay, so no, you don't want to be pregnant. And here's something that 99.8% of the time, I can guarantee you will not get pregnant for the next 5 years, right? So you're 13, 14 now. So until you're 18, 19. And then I could see the wheels starting to turn, because she was like, I did that. Like I set out a goal and now I have a 99.8% chance of success. What else can I do?
Oh,
right. And it was the fundamental thing that I saw for these women and these young girls that really started to change their lives. Right. And so this is how I reframe kind of birth control. I say birth control is not about sex. Birth control is about having a reproductive life plan and feeling empowered in that plan. And just last week, I had a woman, a young girl, she was in her 20s. She started crying because she'd had very bad experiences in her sexual life. So she had a history of coercion. And so this whole topic was a very touchy topic for her. And I said to her, we need to change that narrative for you. And we're going to change it through birth control, because that's what she had come in for. I said, first of all, let's talk about what is your reproductive life plan? And here are the things that can help you. And I want you to feel confident. And I want you to feel good about these decisions that you're making, so we can rewrite the narrative of the negative stuff that's happened in your sexual experiences, right? Let's put it into that piece of empowerment. And so again, with her, I was able to reframe that. And you could tell there was this relief. She was kind of letting go of a lot of stuff that she'd been carrying for many, many years. And so I always talk about birth control. Yeah, like it's not just birth control. It is the tool. It is the most innovative, disruptive technology for women, because it's not by accident that the women's liberation movement happened after the birth control pill came out, because without birth control, we're going to have 10 to 15 pregnancies in our lifetime. And that means we're not doing anything else. Right. And so it's the one thing that's allowed women to really, really create their lives, curate them the way they want, right? And so I always say, fundamentally, that's where we need to start. If you see disempowerment in women anywhere, it doesn't matter if it's worldwide, if it's industrialized, developing nations, start with the reproductive stuff, because you will never convince a woman she can do anything she wants if she cannot get control of her reproduction. That's always going to be step number one.
I love how you ask those questions of that girl. What is it that you want in life? Because she has the power to control it. And I think that's so important. And as you said, in the developing world, they don't have that power, right? They often don't.
Yes.
And almost seems like a simple thing, but it's not. It's become this very difficult thing, a very frowned upon as well, right?
Well,
So
I
whereas,
think it's a mindset change, right?
yeah,
And so you can't convince someone who's feeling disempowered to be empowered, right? You have to switch their mindset first, right? And
mm-hmm.
for women, I think that is really the fundamental place to start, is around their reproduction. Because like I said, you're not going to convince anyone they can do anything if they're just having an unplanned pregnancy over an unplanned pregnancy.
Mm-hmm. What can we do as women, like to help with the girls? What are some of the things we can do?
Yeah, I think that's a great question to have, like to ask women or young girls when you come across them. I think, we ask, oh, what do you want to do with your life? What do you want to be for career? Like we ask all these questions, but we don't ask about the reproductive life plan. And when you think about the one thing that can throw them off, that's probably it, right? And I guess not just to the girls, but to the boys as well, right?
Yes.
It's about, when do you want to have children? And how important is it for you not to have children until you're ready? And so how well versed are you in those things that are going to help you reach that goal, right? Because birth control is actually pretty simple. There's not a whole lot. I mean, I
Yes.
could give you a 20-minute seminar, but I think as a society, we really don't really think about it. We kind of put it in the cloak of sex and bedroom, and but yet we take it out of that. And if you have young girls in your lives, I think we just start to ask them those questions. When do you want to be pregnant? And it's okay.
Yes.
So, and the question about when do you want to have sex, that's a question that I don't really go into, because as a medical professional, I don't feel like that's kind of my role. That's a conversation best had in families, but that's another sort of great question to follow up, right? And then based on what the family values are, you can kind of help your children to construct something that seems reasonable to them along that line.
And open up the conversation so it's not so taboo, right? So, open up so they feel comfortable talking about it and talking about their future plans. And that's amazing work that you're doing. It's so inspiring. I love listening to your explanation of it. It's just wonderful. And how can people find you? Like, do you have articles, or do you have a group, or do you have something that people can go to if they want to learn more about this?
Yeah. So there's two things. So I am doing a TEDx Calgary event. So it was scheduled for March, but during COVID, it got canceled. And so now they are rescheduling a virtual event on the evening of November the 18th. So you can participate live, or it will be recorded. So you can always catch it afterwards as well. So it'll be another, just sort of maybe going into a little bit more depth of this, right? Because I feel like sometimes the world's problems really do seem to be really, really big. But when you break them down, like if you just empower a girl, that leads to an empowered woman, that leads to an empowered mother, that leads to an empowered family. Now you get empowered societies. Do you know what I mean? You can see where all that could follow from, right? So sometimes it's just getting back to the basic, like where is the fundamental first step in this, right?
Yes.
So I think that's great. And then projectempower.ca is the website. So it's a new non-for-profit that we launched early in 2020. And again, during COVID, our activities have kind of come to a little bit of a slower kind of a pace, but we're looking at picking back up again. But that's really about taking this kind of message that we really want to improve awareness and access to long-acting birth control, right? And so, because we really feel the why behind that is we really feel that leads to empowered girls, which will lead to thriving communities, which is what we all want for everybody, right? But you look at any kind of issue, whether it's poverty, you look at crime, you look at like anything you look at, I just feel like you look at, okay, that woman who gave birth to that child that kind of had these issues, like if that woman had felt empowered, how much more different could that child's experience have been?
Yes.
Right.
Yes,
and so I feel like empowered women birth empowered societies. Right. Again, I think we really need to look at that as a resource.
That's incredible. That's a great initiative.
Drop the mic.
Great initiative. I would encourage everybody to check that out. And you said your TED Talk is on November 18th?
Yes.
Yes. Okay, great. Well, we'll put a link to it maybe in the show notes. And you're also speaking for Power Purpose Play in our conference.
The same week.
Yes, on the 19th. So we'll also put a link to that. We're really excited to have you speak on the play part of life, which is really what we discussed, and that's more health and what can we do. And you've just given us some amazing tips on not only empowering girls, women, and society, but also on how we can get rid of our own limiting thoughts and behaviors and really lead the life that we're all meant to lead. And through your example, it's been wonderful to speak to you, and just some great tips and advice. Thank you so much.
Thanks, Kavita.
I so enjoyed my conversation with Dr. Rupinder Toor.
Her passion for the advancement of women's health and the empowerment of women and girls, and her work in the field of reproductive health care is so impressive and important. We can all learn so much from her and her mission to champion women's health and culturally appropriate health care as well. Here are her main takeaways. Number 1, there's nothing more powerful than an idea whose time has come, but you just need to be listening for those ideas because they will come to you in that moment. Don't worry too much about the details. The details will sort themselves out. You just need to be open to listening. Number 2, we need to reframe how we look at aging and not equate aging with decline. It's not serving us well. We do not become older. We just become more of who we really are. Number 3, when something is calling for you, why would you not answer? There's something that's tapping at your door saying, hey, look over here in this direction. 4, the roles we play when we get to 50, some of those roles go into autopilot. We have this window of time now. It's like we're recycled teenagers. Number 5, the first half of your life is all about your learnings, your teachings, and what you're supposed to be doing. And as you get older, it's the process of unlearning and dropping the things that no longer serve you. It's so exhilarating. 6, I no longer have a bucket list. I have another list. It rhymes with bucket. Number 7, women need to realize the value of the resource of women. Because we were biologically and socially designed to look after everybody, the collection of our wisdom is a huge resource. We need to share our knowledge. 8, you don't have to have any special life journey. Your life journey as a woman is special enough. 9, birth control is not about sex. It's about having a reproductive life plan and feeling empowered in that plan. It's the most innovative disruptive technology for women. 10, empowered women birth empowered societies. Thank you so much for listening and for sharing. Our goal with this podcast is to bring forward important concepts surrounding women in midlife, such as what we have discussed today. If you feel like you learned something, share this podcast. The messages are so important. Join our free community at powerpurposeplay.ca. We are here for you, and we have so much more in store. We are wrapping up our pilot program, It's My Time Now, How to Rediscover Yourself in Midlife, and it has been such a huge success. I can't wait to launch it to the public in the fall. If you're interested in learning more, email me at kavita@powerpurposeplay.ca. Until next time, stay safe, stay well, and love and light.